Good morning, everyone. I'd ask people that could take your conversations outside. The Subcommittee on Health is now in session. Please, members, take your seats. We'll call up the first bill from Delegate Bennett Parker, House Bill 380.
You need to take attendance.
Oh, I'm sorry. Let me go ahead and take attendance first. I'm a little rusty here. Everyone, please record your presence on the electronic voting board. All members have voted? All right, we do have a quorum. Now, thank you, Jane, for keeping me straight. House Bill 380, Delegate Parker.
Thank you, Mr. Chair. This is House Bill 380, and this bill was brought to me by a constituent whose son has celiac disease, and they are here with us today. The bill would include celiac disease awareness and safety in the topics of written training materials the state health commissioner must provide to restaurants. Celiac disease is an autoimmune disorder where consuming gluten triggers the immune system to attack the small intestine, damaging the nutrient-absorbing villi and leading to malnutrition, digestive issues like diarrhea and vomiting, fatigue, and other systemic health problems. Recently at a restaurant, my constituent informed the server that her son had celiac disease and cannot eat gluten. Her son ordered a dish and it came out with a piece of bread on top. When she again told the server that her son cannot eat bread, they just took the bread off, demonstrating that they did not understand cross-contact and the very serious health implications of someone with celiac digesting gluten. There are stories like these across the Commonwealth. Celiac disease is not a food allergy, so it is not currently covered by VDH's training materials. This bill is an important step to help protect public health and support the ability of people with celiac to dine out safely. Thank you.
All right, thank you, Delegate Bennett Parker. Any member of the subcommittee have any questions for the patron? And please use your request to speak button if you don't mind. All right, seeing none. All right, anyone in the audience here would like to speak in favor of House Bill 380? Please come forward.
Yeah. Good morning, Mr. Chair and members of the subcommittee. My name is Gabriel, and I have celiac disease. And it makes eating at restaurants hard because I'm afraid of getting sick. This bill will help me and many others eat at restaurants without worrying about getting sick. Thank you.
Thank you. Good morning.
Good morning, Mr. Chairman, members of the subcommittee. Tommy Herbert with the Virginia Restaurant, Lodging, and Travel Association. I come here to say we always want to be careful about supporting the idea of new regulations, but we appreciate what Delegate Bennett Parker is doing here, and we are very grateful that she came to us in the off-season to help us work on this bill. And so we're grateful to see a best practice codified.
Good, thank you. And I do have someone online, but I do want to take the people that are here in the audience first, pro and con. And then we'll go turn to the online. Anyone else here speak in favor of House Bill 380? Any opposition to House Bill 380? All right, let's turn to online. And we have online Ms. Teresa Champion. Is she no longer? She's gone. Oh, wait, she's no longer on the line. Okay, so subcommittee, does anyone have any questions for the patron? What's the pleasure of the subcommittee?
Motion to report.
Got a motion and properly second to report House Bill 380. Please register your vote on the electronic voting board. All members have voted. Clerk will please close the roll. Bill reports 8-0 with 1 abstention. Thank you, Delegate Parker. You have another bill, House Bill 381.
I do. Thank you, Mr. Chairman. This is a difficult bill. This is House Bill 381, and I have an amendment in the nature of a substitute.
All right, okay. Mr. Brooks, would you please report the amendment?
Mr. Chair, the substitute should be available online on LIS, but it changed. The original bill required the Office of the Chief Medical Examiner to inform a funeral service establishment or funeral service licensee if investigation or autopsy of a body required the retention of a whole organ. The substitute changes that so that that requirement is to notify either decedent's next of kin, someone else authorized by law to make arrangements for the disposition of the decedent's remains, or the funeral service establishment or funeral service licensee.
All right, thank you, Mr. Brooks. Can I get a motion to adopt the amendment? Got a motion properly second. All in favor say aye. 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 Opposed? All right, the amendment's properly before us. Delegate Bennett Parker, tell us what your bill does.
Thank you, Mr. Chair. This bill was brought to me by a family in my district to ensure that no other family experiences the additional grief and shock that they did after losing their child. In December 2023, the Speckarts' teenage daughter passed away unexpectedly in her sleep. Because this was an unexplained death of a minor, an autopsy was performed. The autopsy took a few days to complete, and then her body was transferred to a funeral home, and she was buried a week later. Several months later, in March 2024, the family was on the phone with the medical examiner when they learned that the daughter's heart had been sent to UCLA for further testing, where it remained. They thought they had laid their daughter to rest in December, but part of her was still across the country, and they had no idea. They then worked to have her heart transported back to Virginia and buried. My bill ensures that families are notified if their deceased family member's body is transferred to a funeral home missing an organ. This bill will ensure that other families do not experience the shock and additional grief that the Speckarts felt. Mr. Chair, the Speckarts are here to share their story, and I'd like to turn it over to them with your permission.
Thank you. Let me ask first if there's any questions before we take testimony. Any questions for the subcommittee? All right, seeing none. All right, please bring the witness to speak in favor. Good morning. Thank you for being here.
Good morning, Mr. Chair, members of the subcommittee. I'm Catherine Speckart. This is my husband, Richard Speckart. We are here in support of House Bill number 381. As Delegate Bennett Parker explained, our daughter, Clara, who also went by Cameron, passed away suddenly in the middle of her junior year as a junior at Alexandria City High School. She played the clarinet in the Titan Marching Band and was enrolled in the Governor's Health Sciences Academy. She's buried at Ivy Hill in Alexandria. As Delegate Bennett Parker explained, a few months after her burial, we spoke with the medical examiner about the findings of the autopsy, and the report was that there was no clear cause for her passing, and because of this, her death is listed as a cardiac arrhythmia. And it was during this phone call that we were informed that they had removed her heart and sent it to a pathologist at UCLA for additional examination. We were stunned. We had thought we had buried all of Clara. Ultimately, the pathologist at UCLA confirmed that there was her heart was structurally normal, and they too could find no cause that would have explained her sudden passing. We were simultaneously grateful for this additional examination, but also shocked and troubled that no one had told us that her heart had been removed. We felt that we should have been notified so that we should not have been under the false impression that we had buried all of Clara. Because of this, we were left in the unexpected situation of wanting to get our daughter's heart back and bury it with her. What followed was several weeks of trying to work with our funeral home, who said that they could not help us with this unusual situation, and the medical examiner's office that was unable to release her heart directly to us. We had to consider additional costs for funeral home services and a second burial of an urn containing her heart. This predicament added stress and grief upon the stress and grief we have been carrying since her passing. If we had known about the removal of her heart back in December, we could have planned ahead and not been surprised. In the end, we found a different funeral home that agreed to help us. And after all of this, we wondered about other families that may have experienced something similar and the unnecessary additional grief and expense that it caused. To us, it feels common sense that a family should know that an organ has been removed from their relative's body during an autopsy. And we are very grateful for Delegate Bennett Parker's assistance and concern. In Clara's honor, we support Bill House 381. Thank you.
Thank you so much for your testimony, and thank you for being here. We're very sorry for your loss, and it's quite a shame we need a law for this. Anyone else to speak in favor of House Bill 381? Yes, sir, please come forward.
Mr. Chairman, members of the committee, Greg Faulkner. I'm the current president of the Virginia Funeral Directors Association, part owner of 3 small funeral homes, and I thank Delegate Parker for bringing this bill, and my condolences go out to this family. Absolutely, there needs to be something that requires the families to be notified. We were originally concerned with the language as an association, and we are appreciative that the language was changed to what it is, and we are in support.
Thank you.
And we thank you.
Thank you. Anyone else in the audience speak in favor? Anyone in the audience speak in opposition to House Bill 381? All right, seeing none, members, what's your pleasure?
Mr. Chair.
Delegate Price.
Oh,
No, asking for a
okay.
motion.
Yep, thank you. I just wanted to say that unfortunately I have a constituent that is going through the same thing where I think this would have been really important. I know that there are some folks that may not understand. I've heard some pretty callous things said about, well, it's just a this or just a that, you know. But for those families that it matters, bearing the full body, this is really important, and so I move that we report.
Got a motion properly second to report.
Substitute.
Oh, we got a substitute. To move the substitute, House Bill 381. All members, please cast your vote on the electronic voting device. All members have voted. Clerk will please close the roll. Bill reports with substitute by a vote of 9-0. Thank you, Delegate Bennett Parker. Our condolences to you and your family. Thank you. All right, next up, I think we have couple bills. Well, one, House Bill 301, Delegate Carlson. All right, Delegate Carlson, you want to come forward? House Bill 664 that bill is identical to the bill that's before us, House Bill 301. So I'd entertain a motion to incorporate House Bill 664 into House Bill 301.
So moved.
Got a motion properly second. It's a voice vote. All in favor say aye. Aye. Opposed? All right, that bill is incorporated. Delegate Carlson, I understand you have an amendment.
Yes, Chairman Hope. I do have an amendment in response to some concerns or a concern raised by the Department of Vital Records. I would like to add some additional language to just make it very clear that the original birth certificate is not the birth certificate in use, i.e. you don't request your original birth certificate and then have two birth certificates that you can use for use for things.
Mr. Brooks, would you report that amendment?
Mr. Chair, the amendment is line 50, introduced after birth, stricken through. Insert an adult adoptee requesting a copy of the sealed original certificate of birth pursuant to section 63.2-1246 shall submit an application, proof of identification, and payment to the state registrar. No sealed original certificate of birth filed with the state registrar shall be 1, the certificate of birth in use, 2, subject to amendment, or 3, used by an individual for legal purposes.
Is that, Mr. Brooks, is that online now for the public to view?
It should be shortly.
Okay. All right, can I have a motion to adopt the amendment? So moved. Got a motion? Second. Motion properly second. All in favor say aye. Aye. Opposed? All right, the motion is adopted. The amendment is before us. Delegate Carlson.
Thank you, Chair Hope. This bill is in essentially, other than that amendment, in the same exact posture as it passed the House last year, where it passed unanimously 99-0. It is a bill I'm passionate about. Many of you probably heard me speak about it even when I was not the patron. Delegate Walker was gracious enough to hand it over to me. My dad was adopted. I know the difficulties that adopted folks can face when they're trying to access their true and accurate birth certificate. I would like to stress, I wasn't privy to all the conversations that were had about this bill in committee, but I would like to stress it's not about finding your birth parents. That is almost a moot point with DNA. In fact, every member of the organization has found their birth parents through DNA testing, including my dad. It's actually about fixing almost a fallacy that happens, which is that there's never a guarantee of privacy. You actually are given your original birth certificate when you are born. It is actually the adopted parents, if they make a motion to get an amended birth certificate, it automatically seals that original without really very many people realizing that's what's happening. And so this is seeking to fix that. I'm not going to talk much more. I'm happy to answer questions, but I feel like you've all heard this a few times.
All right, thank you, Delegate Carlson. Any members seek to ask a patron a question? All right, seeing none, so why don't we go ahead and take testimony. Anyone here to speak in favor of House Bill 301? Please come forward.
Thank you, Mr. Chair. Members of the committee, I'm Rebecca Ricardo, a licensed clinical social worker, an adoption professional of over 35 years. I'm also an adult adoptee. I am also a mother who has placed a child for adoption. Wearing all of those hats connected to this issue, I really want you to listen to my commentary as a birth mother. When I placed my son for adoption, I was never told, nor was it ever my expectation, that his original birth certificate would be sealed from him forever. I never desired that. I never wanted that. I am supportive of this because as an adopted person, I want to be treated like everyone else, but I'm also supportive of this for my son, who has a right to see his original birth certificate as an adult citizen of the Commonwealth. I ask that you please pass this bill.
Thank you.
My name is Lori Wyatt, and I am a Virginia-born adoptee and lifetime resident of Virginia. I'm also the birth mother of a son that was delivered in 1979 here in Virginia, and adoption has had a huge impact on every aspect of my life. I'm here to let you know that I strongly support House Bill 301 and ask you to please vote in favor of this bill. Unless you're adopted, it's hard to understand all the questions and emotions you have surrounding your birth and where you came from. I believe that being able to obtain a copy of your original birth certificate as an adult adoptee would help answer many of those questions and is a fundamental right that should be granted to all adoptees born in Virginia. Our lives as adoptees started out with very few choices and lots of decisions being made on our behalf that affected every aspect of our lives. I believe that allowing adult adoptees access to their original birth certificate should be a choice they are allowed to make. No other group of people is singled out and denied access to their original birth certificate, the first document that recognizes our existence as a human being, except for adoptees. And I believe it's time for that to change. I urge you to vote yes on House Bill 301 and help make this right a reality in our state. Thank you.
Thank you.
Good morning, Mr. Chair and members of the committee. My name is Ann McKeska. I currently reside in Ashburn. I'm an adopted person and fully support HB 301. This bill will grant equality to adopted persons born in Virginia. I ask you to please move forward and give Virginia adoptees the same unrestricted access to the factual documentation of our birth as all other Virginians enjoy. Thank you.
Thank you. Anyone here to speak in opposition to House Bill 301? All right, let me turn online. I believe we have someone online. Ms. Jamie Weiss.
Good morning, Chairman and members of the committee. My name is Hope Marie Harrelson. I was born in Norfolk, Virginia, and I was given this beautiful name, Hope, by my mother because she had many hopes for my life. And my middle name, Marie, was given to me because her and my grandmother's name was both Mary. Now, you might be a little confused because as the chairman just introduced me as Jamie Weiss, that is the name that I am known by today. That's because at 6 months old when I was adopted, all of the facts about who I was and where I came from were erased and replaced with an amended birth certificate. This was due to my adoptive parents requesting an amended and not of any choice that my mother had. It was not simply just a name change, but everything about who I was changed down to the state that I was born. So instead of Hope from Virginia, I became Jamie from Georgia. So as you decide whether adopted people like myself deserve to have our own factual record, I hope that you will put aside all of the myths and the misconceptions that abound when it comes to sealed birth certificates, and instead remember that sealing birth certificates was intended to keep private information away from public view and not to keep the record from the person who it belongs to, and that it is the adoptive parent's choice to have a new birth certificate issued, not that of any birth parent. So please vote yes on HB 301. I appreciate your time.
Thank you very much. Any members wish to seek recognition? I have a question for the patron. Delegate Walker, you're recognized.
So I appreciate the patron bringing this bill together. It seems like I've been working on this since I've been down here for a number of years. And since we did get it past the House last year, we'll certainly work with the other side of the hall here. This is a very important bill, and this originated in Lynchburg with some folks who came to me. And with all the amendments and things that we've gone through in this process, I would strongly encourage my colleagues to support this bill as it goes forward here. Thank you, Mr. Chairman.
Thank you, Delegate Walker. Delegate Price.
Thank you. I would ask the patron, my LIS is currently spinning. Can you remind me the track that House Bill 550 took last year?
Chairman Hope, I would reply, I might be wrong on this, so it might be better to defer to DLS, but it made it through us. You're asking, it made it through us unanimously. It got held up in Senate, I think in sub. I could be wrong there. I have been having conversations with them about this bill in advance, though, so I'm hopeful for a different outcome this year.
Okay. Any other questions from the members? Okay, what's the pleasure of the subcommittee?
To report the substitute.
Got a motion to adopt this, approve the substitute? Got a properly second? All right. Any discussion, members? Please register your vote on the electronic voting device. All members have voted. Clerk will please close the roll. Bill reports with substitute by a vote of 7-2. Thank you, Delegate Carlson.
Thank you.
All right, Delegate Anthony. House Bill 335.
Thank you, Mr. Chair, members of the committee. House Bill 335 is the Independent Pharmacy Access and Resilience Pilot Program. There was an iteration that was brought forth in 2025 legislative session at full scale. It was a part of the work resolution of the Joint Commission of Healthcare. And as a result of the work of that Joint Commission, they produced a report titled Access to Pharmacy Services in Virginia. And they noted some very important pieces where community pharmacies in Virginia declined by 8.4% between 2014 and 2024. And also noted that in 2024, 14 localities throughout the Commonwealth only had one community pharmacy, 8 of which were independent pharmacies in those same localities, and 6 independent pharmacies were shuttered over the last 10 years. And so while that Joint Commission report was very thorough and really highlighted the issues with pharmacy access that we are facing on today, we wanted to make sure that we included the full story. And so those are some of the things that I brought forth in the Joint Commission and in the testimony. Pharmacy access is not only about distance, but it's about equity. It's about infrastructure, and it's about community survival. And so, we wanted to make sure that we expand beyond the distance-based methodology that is used in the report, and we wanted to make sure that we don't understate the access barriers in both rural and urban communities. And so rural localities that have a single pharmacy face structural fragility. Many urban neighborhoods, especially Black and historically underinvested communities, experience functional pharmacy deserts because of unsafe walking distance, inadequate transit, limited car ownership, and decades of disinvestment. And so this is a scaled down pilot from the 2025 version. It is not a subsidy bill, it's a sustainable infrastructure bill. And we wanted to invoke some temporary fixes that's not gonna solve the full problem, but we wanted to strengthen pharmacy capacity by expanding the clinical services in which independent pharmacies are already providing, including improving chronic disease management, supporting telepharmacy, stabilizing the workforce, and diversifying their revenue streams. And so independent pharmacies are often the last remaining healthcare access, both in rural and urban underserved communities. And so if we want better chronic disease outcomes and better maternal health outcomes, better sickle cell outcomes, then there is a need to stabilize and strengthen the community health hubs within our localities. And so while both chain and independent pharmacies make up the community pharmacy landscape, this bill is particularly about independent pharmacies that experience closure and reopening rates 3 to 6 times higher than the chains. And so that volatility creates, access gaps, especially in rural and historically underserved communities. And that's why within this piece of legislation, we have some criteria listed there that, including not just the pharmacy desert status, but high concentration of households that are 200% below the federal poverty level, any communities that are experiencing high enrollment in Medicaid and FAMIS, workforce shortages, anybody who are experiencing significant transportation barriers, and then there is a historical pattern of disinvestment or inequitable health outcomes. Because of the scaled down pilot, we want to make sure that it works. And so we've given a period of time where there is a report that will go forth to the General Assembly. And then from that report, we'll see if this particular program of stabilization will work. I hope it be the will of the committee to report this bill.
Thank you, Delegate Anthony. And as I recall, I know this came up at the Joint Commission on Healthcare. There were a lot of positive noises about it there. Did the Joint Commission make any formal recommendation about this bill? Do you recall?
Not exactly a formal recommendation, but they were looking for the language of the pilot.
Yeah, I understand there's some positively around that. All right, I do want to note just for the record that if we do report this bill favorably, it will have to go to appropriations. So we can just keep that in mind if there's a favorable vote. All right, any questions? I see Delegate Downey, you are recognized.
Thank you, Mr. Chair. Question for the patron. I believe in the language, it also helps support like vaccine access at the local pharmacies. Is that included in kind of the budget requests that these pharmacies can
Mr.
receive
Chair,
support?
I will answer the delegate that it includes all of the programmatic features that are available at independent pharmacies. And particularly, we do have the pharmacist, independent pharmacist in my community who is here to offer virtual testimony, in-person testimony.
Thank you. Delegate Hodges, you recognize.
Thank you, Mr. Chair. Thank you for bringing this forward. As an independent pharmacy for a number of years, I understand 31 years, I understand the challenges. And there's a need to do something. And there's so many things that are, affecting independent pharmacy and cost barriers and so forth. Just a question for you. I didn't see any budget amendment. Was there a budget amendment that goes along with this? And is there a dollar amount that you're requesting to move this forward?
Thank you, Mr. Chair. Thank you, Delegate. Yes, there is a budget appropriation that matches with this particular bill to fund the pilot.
Thank you. Any other questions for the committee before we take testimony? Okay. Anyone here to speak in favor of House Bill 335? Please come forward.
Good morning, Mr. Chair, members of the subcommittee. Luke Priddy on behalf of the Virginia Society of Health System Pharmacists. They believe strengthening access to community and independent pharmacies in underserved areas helps protect continuity of care and supports health system efforts to ensure patients can reliably access their medications. Thank the patron for introducing this.
Thank you.
Well, good morning, Mr. Chairman and members of the subcommittee. Thank you for your time and thank you for your service. My name is Dr. Anna Peoples. I'm the owner of Peoples Pharmacy, which is a pharmacy located in the medically underserved community in Norfolk, Virginia. I am here to strongly support House Bill 335. Across Virginia, independent pharmacies are closing at an accelerated rate in which most of you are aware, and particularly in medically underserved and rural areas. When a pharmacy closes, Patients do not just switch locations because a lot of them just doesn't have that luxury. Many lose access to their medications because of transportation issues, workforce shortages. A lot of people just don't know how to use the internet. And ultimately, some people do die, and I've seen this personally. So this pilot, and thank you for bringing this pilot to light, but to let you know that this is something that would absolutely work. Currently, this pilot is actually an innovative program that pharmacies, independent pharmacies, are looking at currently. What we're having to do with our low reimbursements is that we're having to change our business model and we're having to pivot. This pilot will allow us to have the infrastructure to do actually that and stop the pharmacies from having to close. By that, I mean, in the bill, it provides for funds, for instance, to have an EHR system. An EHR system will allow pharmacies to run fully compliant clinical programs. A lot of the pharmacies now do clinical programs and also provides diagnostic testing, so we're already doing a lot of the things that are mentioned in this bill. So House Bill 335 is actually a catalyst that we needed years ago. With this bill, you have a chance to stop, we have a chance to stop reacting to pharmacy closures and start building a more resilient, proactive healthcare network. And this is important because a lot of times people come to the pharmacies before they go to the hospitals. They'll call us to find out if there's anything that can be done about their flu or if there's anything that can be done about their arthritis. Before they even go to the hospitals, they come to the pharmacies to see if something can be done. When hospitals can't see folks for COVID, people come to the pharmacies. And a lot of times they get most of their services. I've been in pharmacy for over 30 years. I've worked in retail and I've worked in independent. In retail chain pharmacies, a lot of times you hardly have time to go to the bathroom. Less long, listen to somebody about their arthritis. But in independent, we have that luxury. I won't call it a luxury, but we have the option that we can take time to sit aside and speak to our patients. Okay. So I know I've gone probably over my time, but I wanted to thank you, I want you to please pass this bill.
Thank you.
Because if we don't, we're going to be in worse trouble than what we already are.
Thank you for your testimony. Thank you very much. Anyone else to speak in favor? Mr. Whitehead.
Good morning, Mr. Chairman, members of the subcommittee. Cal Whitehead for the Virginia Community Pharmacy Association. I can't add anything else that Delegate Anthony and Anna Peebles have offered already. It's an important topic, and you all are doing a bunch of great work, and this is an important piece. The only thing I wish was that it wasn't a pilot, but thanks, and please support this bill.
Thank you. Anyone else to speak in favor? Please come forward.
Good morning, Mr. Chair and members of the committee. Ruth Morrison with the City of Richmond. We do support the bill. We have several census tracts that would be relevant, medical pharmacy deserts, as well as an independent pharmacy here in the city that is essential partner in getting the access that the patron has described. So if it's the will of the committee to move it on to its next step in appropriations, we support. Thank you.
Thank you.
Mr. Chairman, I'm Doug Gray on behalf of the Virginia Association of Health Plans. We represent the Medicaid plans, the commercial plans, the exchange plans. We've been long supporters of pharmacists as providers. Critical access areas where pharmacists can be providers as well as offering pharmacy services is critical to access to care and will create savings in the long run by managing people's health before they need to go to the hospital or the ER. So we're very supportive of this effort, and we're hopeful that we can figure out ways to beef up access in rural and underserved areas. Thank you.
Thank you, Mr. Gray. Mr. Jackson.
Mr. Chairman, members of the committee, Charlie Jackson on behalf of the Virginia Pharmacy Association. I want to thank the delegate for her continued interest in this issue and in support of pharmacy generally. Not much more I can add to what Dr. Peebles and others have said. The Virginia Pharmacy Association supports the bill. You heard the governor last night speak a little bit about some of the reasons behind why independent and chain pharmacies are struggling. There'll be more on that later this session, but want to encourage you to support the bill. Thank you.
Thank you. Anyone here else to speak in favor? Anyone in opposition? All right. Any members wish to seek recognition? All right. Delegate Shin first.
Thank you, Mr. Chairman. I'm sorry if I missed it, Delegate Anthony. What was the amount of appropriation that you were seeking for this pilot program?
Approximately $600K.
600,000. Thank you.
For 10 to 12 pharmacies in the pilot.
Delegate Waxman.
Thank you, Mr. Chair. Mr. Chair, I'd like to thank the delegate for bringing this to our attention. I represent 7 localities in the 83rd districts, 4 entire counties, 2 partial counties, and 1 city. And we've got a situation where 3 of the counties that are joining each other on the North Carolina line, Brunswick, Greensville, and Southampton County, no longer have a single pharmacy in those 3 counties. I was informed by a friend of mine last week that has a store in Dinwiddie that his store is closing this month as well too, which will leave that county, as best I can tell, just 1 pharmacy. I just once again applaud the delegate for bringing this. It is much needed. These pharmacies have been receiving so many negative reimbursements. They no longer have the money themselves to invest in improving their store, and I think that this bill would be a lifeline for those 12 pharmacies should they be received. Thank you.
Thank you, Delegate Waxman. Delegate Hodges.
Thank you, Mr. Chairman. Thank you, Delegate Anthony, for bringing this forward. And thank you, Dr. Peoples, for your passionate remarks on the impact that pharmacists can make in people's lives, especially in our underserved areas. And I appreciate you bringing this forward to solve the pharmacy, help to solve the pharmacy desert problem. Many folks don't realize that, pharmacists can test and treat for UTIs, which can be very life-threatening. And with influenza, where hospitals are flooded. Prophylaxis, that's another conversation we're going to have this session, hopefully. But many times they're often the last line and the only access that folks have to health care. So thank you so much.
Thank you. Any other member wish to seek recognition? Just a reminder, if a motion to report this bill would require a referral to appropriations.
Mr. Chair, I have a motion.
Delegate Herring.
Mr. Chair, I move to report and refer to appropriations.
Got a motion and properly second to report and refer House Bill 335. Any members wish to seek recognition? Okay. Clerk will please open the roll. All members cast your vote on the board. Clerk will please close the roll. Bill reports and refer to appropriations by a vote of 9-0. Thank you, Delegate Anthony.
Thank you.
Delegate Martinez. House Bill 373.
Good morning, Chairman and committee members. You should recognize this legislation as it is identical to SB 1350 from the 2025 legislative session, which had passed with broad bipartisanship. HB 371 is a straightforward, common sense measure to improve food allergy awareness and safety across the Commonwealth. The bill was introduced in response to a personal experience shared by my constituents, a parent of 2 children with severe allergies. Her firsthand account of the challenges and risks faced by families with food allergies highlight the need to increase awareness and provide clearer, more accessible information to protect vulnerable individuals and improve safety. The bill simply requires the Virginia Department of Health to post a standard food allergy notice on its 6 most commonly spoken languages in Virginia. The notice would outline procedures for restaurant staff to follow if allergic reaction occurs, how to prevent cross-contact, and actions to take if an allergic reaction occurs, including when to call emergency services. Restaurants would be required to post this notice in employee accessible areas and in any available language spoken by staff. Includes a clear food allergy notification on menus or a conspicuous sign. Importantly, this bill has no fiscal impact. It simply formalizes and standardizes food allergy practices that many restaurants are already implementing. By ensuring that restaurant staff have clear guidance and that customers are encouraged to communicate their allergies, this legislation helps reduce the risk of allergic reactions across the Commonwealth. This proactive approach will help protect the health and safety of Virginians, especially children, and ensure a safer dining experience for everyone, And I forgot to name the bill. It was food allergy awareness.
Thank you, Delegate Martinez. Any members have any questions for the patron? All right, let's turn to the audience. Anyone here to speak in favor of House Bill 373? Please come forward. All right, any members wish to speak in opposition to House Bill 373? All right, any questions from the subcommittee of the patron? Anyone seeks recognition? All right, seeing none, maybe everyone's heard this before. What's the pleasure of the subcommittee? Got a motion to report? Second. Properly second. Members, please cast your vote on the electronic voting device. All members have voted. Clerk will please close the roll. Bill reports by a vote of 9-0. Thank you, Delegate Martinez.
Thank you, Chairman and committee members.
Delegate Seibold, House Bill 376.
Good morning, Mr. Chair.
Good morning.
Mr. Chair, before I begin, some of you may have heard the story, but for new members of the committee, just want to quickly tell you about my constituent's daughter, Kristen Kylo. Typically, they come down and testify, but year after year with this bill, it's been challenging to tell their story repeatedly. So I first met Kristen Kylo as a teacher in Vienna. She was a sweet girl. I taught her in 4th grade. She, excellent student, moved up, headed to Madison High School, Mr. Chair, where she was a star player on the Madison Warhawks softball team. She was recruited by Princeton, where she played softball. She had a passion for life. She was a leader, a great friend to all. At 18 years old, Kristen died in her sleep as a freshman, and she had a history of epilepsy. So her death was due to SUDEP, which is currently ruled a natural death. And as we know, a death of a healthy 18-year-old, Mr. Chair, is nothing but natural. Very quickly, Mr. Chair, SUDEP, for those of you who are not as familiar with it, is an unexplained death of a person with epilepsy, often occurring at night without warning. Nationally, more than 3,000 people die each year from SUDEP, about 1 death for every 1,000 people living with epilepsy. Based on Virginia's epilepsy population, that translates to about 80 to 100 folks a year die here in Virginia of SUDEP. The reason, Mr. Chair, I say that this is estimated is because we do not have precise data for Virginia. Because of the current death investigation system that we have here, it does not consistently collect or report detailed information on SUDEP because it is ruled a natural death. That means families here in Virginia are left without answers, and public health authorities cannot fully understand the scale of this problem within our Commonwealth. This bill will change that by empowering the Office of the Chief Medical Examiner to 1, conduct thorough investigations when a death is consistent with SUDEP and prepare a complete report. 2, provide families with timely information about SUDEP and how they can contribute medical history to the Northern America SUDEP Registry, enhancing research and prevention efforts. 3, publish educational resources and a standardized SUDEP investigation form to improve accuracy and transparency. And finally, ensure that all medical examiners receive periodic training on SUDEP so that deaths are properly classified and families get the answers they deserve. So to the families who have experienced this heartbreak, like the Kylos, they'll finally have an explanation, and this bill offers acknowledgement and clarity on that. For our clinicians and researchers here in Virginia, it offers better data and stronger collaboration. And to all Virginians, it represents a commitment to understanding and preventing needless deaths like the one Kristen Kylo experienced. Thank you, Mr. Chair.
Thank you, Delegate Seibold. Thank you for bringing this bill again. Any members have any questions for the patron? All right, seeing none. All right, let's go ahead. Oh, Delegate Hodges.
Thank you, Mr. Chairman. And looking at this as far as possible fiscal impact, because you're looking at training, registry, and all of those things. As
Delegate Hodges, this will have to go upstairs.
It will have to go upstairs.
It will.
Okay, thank you.
Yes, thank you. Get your motion ready. All right, anyone here to speak in favor of House Bill 376, please come forward.
Hi, my name is Adam Gibson. I'm here representing the Epilepsy Foundation of Virginia. I'd like to offer our full and enthusiastic support of this bill. I can also speak to the enthusiastic support of the National Epilepsy Foundation. As the delegate explained, SUDEP is sudden, unexpected death in epilepsy, which places it squarely within the mandate of the Office of the Medical Examiner. In fact, the National Association of Medical Examiners published a position paper on SUDEP and stated that the likely significant underreporting of such deaths by medical examiners and coroners hampers advancements in research and public health, but more importantly, fails to meet the responsibility of a medico-legal death investigation to provide accurate death certificate. We believe that the mandate of the medical examiner's office is protection for all Virginians, so that if a death is unexplained or unexpected without apparent cause, that will be investigated by the state, and we believe that individuals with epilepsy deserve that same protection. Thank you.
Thank you.
Mr. Chairman, Rob Bohannon, representing Harbor Path Policy Council. We are a nonprofit seeking to support patients and state policies that help folks living with disease. Thank Delegate Seabold for bringing the bill. The good news is, our view is this is a great way to get information. As we said, there's not a lot of information out there, but this helps get us more information to better understand this disease. And the 3,400 deaths she mentioned per year that happen across the country, that's more than the annual deaths of those caused by fires or sudden death and infant death syndrome. So appreciate the bill, and the education piece is key. Thank you.
Thank you.
Clark Barron with Medical Society of Virginia. Mr. Chairman, we support the bill and appreciate the delegate bringing it forward.
Thank you. Anyone else here to speak in favor of House Bill 376? Any opposition to House Bill 376? All right, seeing none. What's the pleasure of the committee? And again, just a reminder, proper motion to, if you're going to report, is to refer it to appropriations.
Move to refer.
Got a motion and properly seconded to report and refer to appropriations, House Bill 376. Members, please cast your vote on the electronic voting device. All members have voted. Clerk will please close the roll. House Bill 376 reports and refers to appropriations by a vote of 9-0. Thank you, delegates.
Thank you, Mr. Chair, members of the committee.
All right, next bill is House Bill 6, Delegate Price. As she's making her way down, the last bill on the docket will be mine after Delegate Price's, and I will relinquish that to maybe Delegate Price to chair at that time, so we'll alternate. But for now, House Bill 6, Delegate Price is before us. Delegate Price, you're recognized.
Thank you. Mr. Chair and members, House Bill 6 is the same as House Bill 609 from last session. It would codify a person's right to contraception, preventing any state or local actor from infringing upon an individual's right to access various types of drugs and devices for the purpose of contraception. These drugs and devices are used for people to decide if and when to have a family by preventing pregnancy, and they are used to treat other health issues like endometriosis and polycystic ovarian syndrome. I would like to reiterate 2 points from our previous conversations. This bill prevents state or local laws, regulations, and policies from restricting access, and contraception is not the same as abortion. It is really important that as we see so much from the federal level being kicked to the state level, that we continue to work to protect Virginians' right and their access to contraception.
Thank you, Delegate Price. Any questions for the patron from the subcommittee? Delegate Waxman, you're recognized.
Thank you, Mr. Chair. A couple of questions I have. One is, most of these medications are prescription medications, and being a prescription, in fact, is a way to restrict or regulate. I'm a little bit caught up in that concept that we've got prescription regulated medications, and this bill, if passed, would mean that there would be no restrictions on it. How does that operate?
Yeah, so the state or locality would then not be able to pass a restriction on the FDA-approved contraception methods, drugs, and devices. So I'm not sure that I understand your question. If you could say it a different way.
Yeah, Mr. Chair, if I could.
Delegate Waxman.
A prescription process is a way of restricting access. It has to have a prescription from a prescriber. when we say we remove all restrictions, that means that there is no prescription required for this process. And the reason we require prescriptions is some medications are better for certain individuals than the other. Like a woman who has a history of cardiovascular situations or blood clots, there are actually black box warnings on the inserts for contraceptives that say that they should not be prescribed like high-dose oral contraceptives. And the way I read this language, it seems like that would negate those safety guards that are in place to protect the patient.
Mr. Chair, I would just respond that that is not how I read it or any of the attorneys that we've worked with. I myself, I hate that this is a private conversation, but we're having to make it public.
No,
because
Delegate Price, I don't read it that way, Delegate Waxman. Mr. Brooks, if you want to opine as counsel, but I don't see that as a restriction of having a prescription. Did you have another question, Delegate Waxman?
Okay.
I'm sorry, I could not hear that.
Did you have another question?
No, those were the two related questions.
Okay.
Thank you, sir.
All right. Delegate Hodges.
Yes, sir. And just kind of to follow up on that and to make it maybe a little bit more concise, can this in any way interfere with the physician-patient relationship when a physician says you're not a candidate for contraception?
Mr. Chair, again, I would say the same answer, that this is towards state and local bodies and making their regulations. This is not about a patient and doctor relationship unless there is a part where it does allow for a prescriber who has faced a local or state restriction from giving contraception or that they could sue.
Yes.
Right. But this is not between, I would not put for anything forth that would do that because I myself couldn't take one because of blood clots. So this isn't about that at all.
The prohibition is against local or state government to restrict, not the prescriber. Okay. Any other questions for the patron? All right, seeing none, let's turn to the audience. Anyone here to speak in favor of House Bill 6, please come forward.
Mr. Chairman and members of the committee, I'm Jamie Lockhart, Executive Director of Planned Parenthood Advocates of Virginia, and we support this bill. Thank you.
Good morning, Nicole Lauder on behalf of the American College of Obstetricians and Gynecologists, and yes, we do support the bill. Thank you.
Thank you. Anyone else here to speak in favor? Anyone speak in opposition to House Bill 6?
Mr. Chair, members of the committee, my name is Dr. Michael Huffman. I'm the Executive Director of the Virginia Assembly of Independent Baptists, and while we respect the decision about legitimate contraception being between a husband and wife and their God, the bill goes too far by including abortifacients under the umbrella of any drug. Now, the patron said various drugs just a moment ago, but the bill says any drug. When chemical regimens like RU-486 and misoprostol, they do not prevent conception. They first deprive the developing unborn child of vital nutrients and then induce delivery of the lifeless body. This is early abortion. This is not contraception, but this piece of legislation would allow this unrestricted. Allowing a right, quote unquote, to a medicine that will allow one human being to deprive another human being of life-giving nutrients isn't health care, and it shouldn't be a right, is barbaric. We urge lawmakers to amend or reject HB 6 to protect true contraception without compelling complicity to abortion. Life deserves better protection than this overbroad definition allows. Thank you, Mr. Chair.
Thank you.
Mr. Chair, members of the subcommittee, Jeff Caruso with the Virginia Catholic Conference. When the bill on line 27 says a person shall have the right to obtain contraceptives, a person is not limited to adults, so thus includes minors. Also on line 26, the bill's cited definition of healthcare provider, if you go to that code section 8.01-581.1, that includes pharmacists, dentists, optometrists, podiatrists, chiropractors, physical therapists, psychologists, social workers, marriage and family therapists, and others. So this bill would therefore allow a minor to bypass a physician and get contraceptives directly from a pharmacist or even from a dentist, optometrist, social worker, or any other professional listed in the bill's cited definition. Since contraception is defined in the bill to include the use of sterilization procedures, the legislation would also give minors a right to be sterilized. Granting minors a right to be sterilized undercuts and bypasses current law that requires parental consent before a minor can have a surgical procedure, such as a sterilization. And then finally, the legislation would also undermine the religious liberty and conscience rights of hospitals and health clinics. For example, the legislation could subject faith-based or religiously affiliated hospitals and clinics that do not provide sterilizations or emergency contraceptives to lawsuits. So for these reasons and others, we urge you to oppose the bill. Thank you.
Thank you.
Good morning, Mr. Chair, members of the subcommittee. My name is Elena Whitlock, speaking on behalf of the Family Foundation, speaking in opposition to this bill. We agree with the previous statements by Mr. Caruso. And for the reasons that he stated, we oppose the bill. Thank you very much.
Thank you. All right, anyone else there speak in opposition? We do have one person online, Dr. Patricia Heyer. Are you with us, Dr. Heyer?
Yes, I am. Thank you so much. So I'm Patricia Heyer from Blacksburg, Virginia, and I'm representing the League of Women Voters of Virginia. And the League of Women Voters supports HB 6. Contraception should be accessible to all, and this bill assures individuals the right to obtain and use contraceptives and protects healthcare providers and others who assist in providing contraceptives. Most importantly, it ensures that the Commonwealth and the localities cannot interfere with this guaranteed access to contraception. We believe contraception is critical to the management of healthcare conditions beyond pregnancy, as described by Delegate Price. And we urge you to support HB 6.
Thank you, Dr. Heyer.
Thank you.
Any other questions for the patron from the subcommittee? All right, seeing none, what's the pleasure of the subcommittee?
Move.
Got a motion to report, is properly second. Please register your vote on the electronic voting board. All members have voted. Clerk will please close the roll. Bill reports 5-3. All right, I'm going to relinquish the chair to Delegate Price for House Bill 222.
You have the mic, Mr. Chair, and we are with House Bill 222.
Thank you. Thank you, Madam Chair, members of the subcommittee. House Bill 222, we do have amendments, and I'd ask the council to please report those.
Madam Chair, there are two amendments to the bill. First, line 11, introduced after 32.1-248.1, strike posting of water quality test results by certain recreational, and insert regulations for public aquatic. Second is line 16, introduced after the, strike daily.
Can I get a motion on the amendments?
Move to adopt.
The amendments have been moved and seconded. All in favor, please say aye. Aye. Any opposed? The amended bill is now before us.
Thank you, Madam Chair, members of the subcommittee. House Bill 222 will authorize the Virginia Department of Health to promulgate regulations for the operations, maintenance, and safety of public swimming pools, spas, water parks, and other venues statewide. This might be a surprise to most people. The Virginia Department of Health does not have oversight over local swimming pools. They have oversight over hotels, but for whatever reason in the code, they don't. And we're one of a few states that don't have this regulatory oversight. So think to yourself, if you're in a swimming pool, you see it cloudy, maybe you can't see the bottom, that's obviously a drowning issue. I hate to get gross this early, but there could be fecal matter in there. No regulations whatsoever to deal with that. Localities can, and many do, there's about 19 of 100 localities already have stringent regulations. My jurisdiction of Arlington has them, but only 19 out of 100. That means the majority of localities have no oversight when you show up at a public swimming pool, and that's not something very pleasant at all. So that's the bill that's before you. It would give VDH the oversight. The amendments that we just adopted were their recommendations, and happy to answer any questions. Thank you, Madam Chair.
Are there any questions from the committee? Oh, sorry. Delegate Hodges.
Thank you, Madam Chair. And just to, so we're on the same page, this only applies to public pools, not residential pools or those within homeowner associations, and that would still be considered private.
That's right.
Okay.
Delegate Waxman.
Thank you, Madam Chair. I see that there's no in the physical impact, there's no need for a budget. And you just stated that there's like 19 localities out of the 140 some that we have. I am surprised that VDH isn't going to have to hire more inspectors to go to all these other localities. But
No, this is not my first time to bring this bill. There's no fiscal impact in the past, and there's not one this year.
Thank you.
They can do this.
Any further questions from the committee? Seeing none, is there anyone in the room that is looking to testify in favor of this legislation? Please come forward.
I want to thank the subcommittee and the committee and the delegate for keeping to bring this forward again and again. It is about health. It's also about safety. I've trained over 1,000 instructor trainers for life-saving. And it includes the ability for the health department to say, you know what, in this facility, you should have safety oversight as well. So it's health and safety. We are Chrissy and I are very active in the Richmond Group and the Virginia Life Saving Association. And there's broad support across the entire industry about making sure that we have some sort of oversight. It can be the Wild West, and it doesn't have to be. It's health and safety. Thank you. Oh, I'm sorry. Ted Quinn from Swim RVA.
Good morning. My name is Chrissy Fandel, and I am the Executive Director of Drowning Prevention for the YMCA of Greater Richmond. I'm in support of House Bill 222. Virginia has pools everywhere, and we are left to our own devices to look at the Model Aquatic Health Code and to interpret what is best practice. And this will help us to have support from our health department to make sure that our pools have standards and are safe. Thank you.
Is there anyone here to testify in opposition to the bill? And do we have anyone online? All right. Mr. Chair, would you like a final word?
I appreciate the subcommittee's adoption of this bill.
All right, and we'll come back to the committee. Any questions or comments, motions against poop in pools?
Move to report to remove poop in pools, Madam.
As amended.
Thank you.
As amended.
Madam Chair, can we call this the Baby Ruth bill?
No, if you didn't hear it, you are lucky. I've heard a motion. Is there a second?
Second.
It's been moved and properly seconded to report with amendments House Bill 222. If the clerk will please open the rolls. Thank you. And members, cast your votes. That bill is recommended to be reported with amendments 8-0.
All right, everyone, that completes our docket for today. The subcommittee stands adjourned. Thank you.